you guys, I'm going to be demonstrating how to put in an NG tube and then removing an NG tube for 2 of your checkoffs. I'll post another video that is demonstrating setting up the feeds and giving a medication through an NG tube. But this one is just for inserting and then the removal. Okay, so the first thing I want to do is double check my doctor's orders that I've got an order to put the NG tube in for, whether it's for feeds or for suction. If it's to suction, then I want to know if it's intermittent or continuous suction and the size of the tube as well. Okay, so I've got my doctor's orders. I'm going to gather up my supplies. I need my NG tube. I need the securement device on his nose. If we're doing feeds, then I need the Lopez valve as well. I need a syringe to withdraw those gastric contents, my pH strips, glass of water with a straw, a pen to mark the tube, a pen light to double check, my anti-reflux valve, which would normally be in a packet, and a pin and an elastic band to pin it to their gown, water-soluble lubricant, and then finally a swab with the tincture to put on his nose. Okay, so I'm going to enter into my patient's room, introduce myself if I haven't done so already, let him know that we're going to be putting in an NG tube and why, and what he can sort of expect from that procedure. If he's able to, I'm going to be getting him to hold on to a glass of water and teach him that he needs to swallow when I ask him to swallow. And that if he has any discomfort or distress at all during the insertion, if he can raise up one finger, we can take a break, and then we can just take a break and I can start again. I'll double check his ID band, ask him to state his name and his date of birth. And before I get going, I'm just going to draw the curtain around for privacy. Okay, I'm going to wash my hands, put on my gloves, and I'm just going to start by visually inspecting his nose, ask him if he's had any previous skull fractures, skull surgeries, if he's had any nasal surgeries, if he's had a deviated septum. I'll ask him to blow his nose, and then get him to occlude off one nostril to breathe through that one, and then occlude off the other nostril and breathe through that one, and ask him which side he feels the air moves better through, and then that's the side that will go with. Okay, I'm going to get my NG tube. The size is indicated right on the bag. I'm going to go with a 14 French. Going to wrap the tubing around my hand. It just sort of warms it up a little bit and makes it into this curved shape, which helps you insert it a little bit. I want to measure the length that I'm putting in, so at the end of the nose, tip of the ear, down to the xiphoid process. I'll mark that spot with my thumb and then mark it off with my Sharpie, and that's the length that I'm going to insert to. Make note of the number where it is, and then also this number is going to be documented in the chart. Okay? Gather up in my hand. I've also got some water-soluble lubricant, which makes it a little bit easier for it to go in. So I'm going to open up my packet. I could put it on my sheet here. Put some water-soluble lubricant on there, and we're good to go. So, get a patient to hold on to the glass of water, get him to swallow when I ask him to swallow. And I'm going to insert in the tubing. First off, his head should be back. As I put it in and I get to the back of the throat, he should put his head forward, and I'm kind of twist the tube a little bit. When I get to the back of the throat, that's when he should be starting to swallow. So I'll ask him to swallow, 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 all the way into that part that I've marked with a pen. Ask him how he's doing, if he feels okay, if he's any feeling gagging or shortness of breath or anything like that. I'm going to secure it to his nose using the securement device. There's different kinds that you might see. I'm just going to double check with my pen light and have have a look. Have a look and make sure it's not coiled in the back of the throat, but if it is, then really he would be able to feel that. I'm going to get my anti-reflux valve. The blue goes to the blue and place that on. And actually, before I tape it up, I'm going to get my 60 ml syringe and withdraw back on some gastric contents. And I'll just secure that for now. In my little cup, I'm going to put those gastric content, get my pH strip, dip it into the fluid, wait for that to react, and then compare it on to the levels on the packet. It should be less than 5. That's telling me that it's in the gastric, it's in the stomach. So we're good there. Okay. I'm using a piece of tape to secure this, but I could also, typically what we'll do is we'll have an elastic band with a pin to pin it to their gown. If it's to suction, it needs to be secured like that. But in this scenario, we're actually going to be using this tube for feeding, so I'm going to attach a Lopez valve as well, sort of a 3-way connector to allow me to give some medications. Okay, provide patient teaching. To ask my patient to let me know if he's experiencing any negative symptoms, shortness of breath, if he's had an episode of vigorous coughing or vomiting, to let me know, because then that can dislodge the tube. If he feels any cramping, bloating, pain, nausea, like I said, to let me know. I'd leave him in a comfortable position. He should be sitting up at least 30 to 45 degrees. So I'll leave him in at least that high or sitting up. Leave him with his call bell. I'd get rid of all my supplies here, gather that up, take off my gloves, wash my hands, come over to the laptop, complete my documentation. I'll document the size of the tube that I put in, which nares I put it in, the length that went in, so that whatever marker that is, whether it be 50 or 53 centimeters, to put that in. That if I connected to suction or if I connected to feeds, how the patient tolerated, and any patient teaching that I would have provided. For removal, let's just say it's a few days later and I've got a doctor's order to remove the tubing. So again, I'm going to double check my doctor's orders. I have an order to remove the tubing. That's great. I don't really need any supplies other than maybe a blue pad or just some sheet to put on their chest. I'll come into my patient's room, introduce myself if I haven't met him that day already, let him know that we're going to be taking out the tube, ask him to state his name and his date of birth, double check his ID band, and we're pretty much good to go. I'll just wash my hands. Going to place on my gloves. Okay, got my blue pad on his chest. I'm going to first unpin or untape in this situation. If he's connected to feeds, I'll remove the feeds, turn off the pump. If he's connected to suction, I will turn off the suction and remove this from the suction. So I just have this tube. I kind of gather this up. Remove the securement device. These can be like really sticky and a bit gooey. This one's really easy to take off. Okay, and I'll ask my patient to take, first off I'm going to kink off the tube with my left hand a little bit. So I'm just going to kink it off a little bit. That's just so no fluid will escape as I'm pulling out the tube. Ask them to take a big breath in and hold it as I remove the tube. Take it out, coiling it up on my hand. Okay, you can breathe normally. Provide him with a tissue so he can wipe his nose if need be. If he's able to, take a sip of water or a swab to wipe out his mouth. Again, provide a little bit of teaching. If he needs to, if he's had any discomfort or if he has any pain, abdominal distension, nausea, vomiting from the tube coming out. Place him in a comfortable position. Leave him with his call bell nearby. Get my tube, remove my gloves, wash my hands, and then I would document that I removed the tube, how he tolerated, and if he had any concerns about that at all, and what patient teaching I did. Okay.